started. Good morning, everybody. And we're going to turn it over to Dr. Kampa and Faye to kick us off.
Good morning, everybody. I'm so glad to see you guys back here bright and early, 8 o'clock, ready to go. So we really appreciate that. So we're going to, as you guys probably remember, we went through kind of the vaccine myths and just the basics of the vaccine. And now we're going to go ahead and segue into the COVID-19. Okay. Oh, are we going out? Okay. We're going to go ahead and segue to just the motivational interviewing part and how to really start the communication with our patients and their colleagues, perhaps. So the objectives are part one, review current trends in COVID-19 vaccination data, describe vaccine development and immunity concepts, which we went over, and review common myths versus facts around the COVID-19 vaccine, which is what I just discussed. We went over the last time. So now this is part two. We're going to describe reasons why some patients have not yet been vaccinated against COVID-19, understand concepts and techniques for effective patient engagement around COVID-19 vaccination, including motivational interviewing, and then apply that motivational interviewing to facilitate effective conversations about COVID-19 vaccine. And we're hoping to have not only a Q&A, but also practice, how we can apply this and maybe work through some techniques in terms of so that we can set you all up for success. Next slide, please. And we talked a little about this the last time, but just to show what the vaccination rates, including vaccination delivery outside of DHS, looks like. And as you can see here in the blue, the vaccinated active and panel patients, there's just a lot more of those vaccinated amongst our active and paneled versus our vaccinated inactive and paneled. But in the orange is also the vaccinated total and panel 12 years old and plus. But just we just want to show this the contrast between those who are active versus those who are inactive, and across the ethnicities. So who remains unvaccinated? As you can see, if you see this share who report receiving COVID-19 vaccine continues to increase, with few remaining eager to get a vaccine as soon as possible. So the vaccinated and unvaccinated are kind of put into buckets of already gotten, as soon as possible, wait and see, only required, and definitely not. So what findings shows is, as you can see, already gotten, these are those who are eager and ready to get it. And also the next group, who's as soon as possible. The group that we're definitely working on is the wait and see, and then we have the more hesitant and less eager, which is only if required and definitely not. And so some of the findings show that certain variables, such as whether the FDA approves completely, will make a difference and may show about a third of that increase. And also some of the hesitancy with this response is due to the perception that the CDC guidelines have been very confusing for some people. About 40% or more say that the CDC guidelines were confusing, and if they were to say that there were no mask requirements, it would definitely encourage others to go to get vaccinated. And another piece is incentives. So, and we'll talk more about it in the next slide. But more incentives, such as the employer allowing people time off to get the vaccine, definitely promotes vaccination. So this slide shows just again working with these buckets, how it breaks down among different ethnicities and groups. And as you can see in the highlighted arrows, the Hispanics and Black adults are still who we're working on, along with the age groups of ages 30 to 49 and 18 to 29. And again, some of the motivating factors are very similar to what we just discussed, which is FDA approval, time off, other incentives like transportation, and maybe some ironing out the CDC guidelines and just making it more consistent, which is very hard in a changing pandemic environment, right? Okay, next slide, please. Okay. So again, who remains unvaccinated? So kind of adding to what we've just discussed in the other slide is the children. So 4 in 10 parents say their adolescents have already received a COVID-19 vaccine or will do so right away. And even when we're talking about waiting for the EUA for 12 and under. There's still some wait and see, and there's still some concern, especially since it hasn't been approved. But currently, we still have a really good potential of wait and see that we can work on based on those on some of those encouraging factors that we discussed, that I just discussed in the previous slide. Next slide, please. Okay, so again, who remains unvaccinated? There are 5 personas that have been kind of delineated. One is enthusiasts, which we don't really need to talk about because it's essentially what it states it is, which is they're the go-getters, first early adopters. I'll get the vaccine as soon as it's available. Then we have the watchful. The watchful are those who value the social norms and may want to see how others or peer groups get vaccinated first and make sure that they're safe. The next group is the cost anxious. So the cost anxious primary barriers are time and cost, may delay seeking care in the past due to expense. So cost also includes factors like, again, the time off piece that keeps coming around, and just the effects of the vaccine that might impact work. And then the fourth group is the system distrusters. So these people believe that race community are not treated fairly, so there's inequity in the healthcare system. And finally, we have the COVID skeptics. And we talked about many reasons why people are doubtful about the vaccine. We talked about the myths, etc. And this kind of bounces around the group, but primarily with the COVID skeptics. And so the point of this is that we have 43% persuadable group that include the watchful, the cost anxious, and the system distrusters. So knowing this group and their thoughts and how they think, their perspectives can really help us encourage these folks to get the vaccine. And just actually a plug in here, I hear a lot of like, why some people feel concerned that why is the vaccine free? It makes me want nothing in healthcare is free. Why is the vaccine free? Well, it's not free. We're all paying for it already out of pocket because it's a government funded vaccine. So you might as well take advantage of something you're already paying for with tax dollars. So that's a point that you want to make for those who say statements like that.
So that's an interesting point, that it's not paid for by other monies. It's truly paid for by tax money that's going to, support public health. We have a comment in the chat from Kevin. He has said, I met 2 students in my pre-med program who are future doctors and do not plan on getting the vaccine. Kevin, do you know what the reason for their hesitation is?
Political. They believe that their body, their choice. But then again, it's like their body or their choice is also going to affect a lot of more people around them. We try to talk to them into it. They don't seem to budge. They seem to say that, no, it's science. I do not want to be another sheep, which I've heard through a lot of other people who don't want to get the vaccine because they don't want to be a testing sheep, but they don't understand like the good stuff that's actually helping. Like you might not want to get it for yourself, but vaccinating yourself or helping create herd immunity and somehow.
Yeah,
It sounds like they fall into that category of the COVID skeptic, right?
Yeah.
And we know that their persuadability is a lot less, right? Because they have some really ingrained beliefs about healthcare system and politics, right? Which make it harder for evidence-based conversations to potentially persuade them. So.
Yeah, and I would also say maybe this is where stories could be powerful. A few weeks ago, I read an article of an African-American 34-year-old who was a strong, devout Christian and was against COVID, the vaccine the whole time, got COVID, and was a COVID skeptic until he died. And unfortunately, he passed away because of COVID. And we see many people like this, and maybe, but we do also see those who, when they're really sick and realize that this is real, that then try to help the rest of the world and tell them, please get this vaccine. It's really important. This is what I'm going through. And sometimes it takes a personal experience to go through that. And now that we have the Delta variant, and I can speak for myself when I talk to my colleagues about this, a lot of my colleagues who are vaccinated have gotten the Delta variant and got sick. And so and one of them actually, she said her husband, who is the poster child for like immunocompromised, really have comorbidity and multiple comorbidities. And she said if he probably did not get the vaccine, he would be ventilated in the ICU right now. So I think, and you guys talk to so many people, so definitely using that, leveraging that, like personal connections and stories might help with the COVID skeptics.
Yes, thank you. I think it's interesting because I think overcoming the different barriers and resistances, it's different for every person. And I think, there's a strong piece of American culture, that sense of freedom that Kevin mentioned. It's my choice. It's my freedom. It's my this, it's my that. And I don't think any of us recommending the vaccine want to take anyone's freedoms away or force a choice on people. I think that's a false argument, quite honestly. It's because I think they're using that sense of freedom in an exaggerated sense. I mean, the one that I always hear is, yes, but do you wear a seatbelt? Do you smoke inside a building, or do you smoke inside of the office building? It's like those are public health laws now that we have that protect people from their own actions and the actions of others. And they've been proven to be successful and smart choices. So your freedom is there, but you still live within the guardrails because you live in a society with others.
Right. And I think we all would like the freedom to not wear masks outside and just go back to a better normal, not necessarily just the past normal, a better normal. So looking forward to that freedom, being able to use that.
Exactly.
All right, next slide. All right. So how are concerns about COVID-19 vaccines expressed? And they're really expressed in multiple different ways. And here are some examples. I'm not too sure it's safe to be vaccinated. I was already sick with COVID, so I don't need the vaccine. And again, I want to really highlight this example because I've just talked about an example of people getting sick, even with having the COVID vaccine, especially with a very contagious Delta variant. And here are just some examples of what concerns people are expressing. And I think this is the important piece to really hone in. And this is why you guys will be so valuable in the field, because you get to hone in on what the concern is for that particular person, not necessarily generalize a concern. Hey, you're concerned about this, this, and that, but no, really, what are your individual concerns? So and how we can impact it is not only by asking what the concern of vaccination for that individual is, but also to really build that rapport and have that vaccine confidence with trust. And you guys are probably one of the best to develop this trust with people, because you are always out in the community and probably have your style of being able to build rapport, but being able to make strong, empathetic recommendations, building that relationship is really important. And even linking them to healthcare providers or other healthcare professionals might also help. But really having that relationship with them and building that trust during that conversation is going to be very important. Next slide, please.
I just wanted to emphasize that, Faye, because I think the next few slides, as we get into this behavioral piece, right, really learning how to have meaningful conversations, what Faye mentions is really important, right, is that we now have to move away from the basic talking points, because we've already got the enthusiasts, right? They're vaccinated, they're protected. We're now with this group of people that we're trying to talk to. And so we really have to hone in, like Faye mentioned, on what their questions or concerns or skepticism is, and then use the tools that we're going to learn in the next few slides to start to navigate a conversation that can lead them to potentially successfully receiving the vaccine. So we're going away from just saying the vaccine's good, the vaccine's effective. Now we're looking at what is this person's core hesitancy or apathy, and let me try to create a framework of conversation to help engage them.
Yeah. And you're gonna see this throughout the presentation that it's not don't expect to have them back. We talked about this before too. While we're gonna start this conversation, I don't feel bad if you don't get them to get vaccinated. This process takes some time, and it is a process, so that's what we're gonna be showing you guys here too. But we will try to give you the tools to be able to engage to promote behavior change and motivate using motivational interviewing. Okay, so here for patient engagement, must start before treatment. So these are some of the pointers. Engagement is not synonymous with compliance. Compliance means an individual obeys a directive from a healthcare provider, and engagement is a process of harmonizing robust information and professional advice with one's own needs, preferences, and abilities in order to prevent, manage, and cure disease. So an important piece here, the whole theme here is this is bi-directional. I mean, traditionally, I think we've been a healthcare society of telling a patient what to do, but we've seen through outcomes that does not really help with adherence and helping them improve their care. So these points are very important, and I think we're moving away from the word compliance anyway, and moving away from the word compliance and really engaging patients and this will take time, but it's really important in order for the whole kind of care plan or just the discussion points to be effective. Next slide, please. Is there a question?
I don't think there was actually a question in the chat, Faye. Someone is asking, in a household with a couple, why does one person get COVID while the other partner who is exposed stays COVID free?
I mean, so here's the thing. We have to take a lot of things into consideration. One is, first of all, obviously, are they both vaccinated? Two is that sometimes we have to take into the factors of the testing. I just heard of an incident yesterday where someone got tested way too early. They found out their partner had symptoms, so they got tested the same day, and that might factor into it, right? Because normally you'd want to take the test either 5 days after exposure or 5 days after, or at least 5 days into where you got symptoms, just to make it more effective, because we do know that there's a chance for a false positive or a false negative. And another piece is there's multiple factors here too in terms of, how close were they together? Did they interact? There's multiple factors, but more commonly, usually when one person gets it, there's a situation where one person was vaccinated, one person wasn't, but they both eventually got COVID once they stayed in the same room together for a long period of time. But sometimes people are lucky and they take the proper precautions right when they find out, and they start quarantining, and maybe that turns out to be effective. But then in those cases, you would want to still promote quarantining for the other person, just in case they're either asymptomatic or they get symptoms later. I don't know, Dr. Kampa, do you want to add to that?
Yeah, every situation is different, and right, we can't take stories that we're hearing and make them blanket predictions for other folks, because there's so many, as Faye mentioned, variables. The chance that you will become infected if you're in close contact with somebody who's symptomatic is very high, and I would recommend vaccination. And if there is somebody who's symptomatic in a household of other people who are not, they really need to be isolated for the 10 days or until their symptoms resolve. Because otherwise, I think, knowing this Delta variant is the predominant virus out there, the chance that other people will get infected is really high.
Yes.
All right. So I'm sorry, I'm going to ask everyone to hold for one quick moment. Unfortunately, our translator, Fabiola, she lost connection, so she is not with us at the moment. She's trying to log back in.
Okay.
So we're going to continue forward, but hopefully, I apologize to our Spanish-speaking audience. Unfortunately, she's lost her contact. She's trying her best to get back into us. I did have another question, Faye and Dr. Kampa, about the FDA approval of the vaccine. Is it true the FDA has not approved the vaccine? In the community, they give me that reason not to get vaccinated and also mention all the side effects that have been reported.
And I think we talked about this in the slide deck already today. That is one thing that we are expecting to hear out in the community. And as a matter of fact, the statistics show that about a third will says that they're more likely to get it once we have FDA approval, full FDA approval. So there's a difference, right? We have an EUA, which is an emergency use authorization that is essentially given by the same body of the FDA, the governing body of the FDA. So, or a subset of that governing body. So, with that said, yes, we are waiting for full FDA approval, but really at this point, it's only paperwork that we're waiting for. All the crucial steps and phases have been completed and done, and there is no reason why we won't expect a full FDA approval sometime in the near future, as soon as within this month or next.
Yes, thank you, Faye. I wonder, Dr. Kampa, if you'd be able to share some of the highlights of what Faye had just shared with us in Spanish for our Spanish speakers.
Sure.
On the fly for simultaneous translation.
Entonces, sí.
Oh, yay. Fantastic.
Estamos esperando el FDA que le da todo, que autorizan la vacuna, pero ahora tienen autorización de emergencia y es lo mismo parte del gobierno del FDA que dio esa clase de emergencia para las vacunas de Pfizer, Moderna y Johnson Johnson. Entonces, es nomás estamos esperando que todas las compañías entreguen sus papeles, los datos, la evidencia, que todo sigue con seguridad. Eventualmente esperamos que llegue la autorización completo para las 3 vacunas. Entonces, es nomás tiempo que estamos esperando. No hay evidencia que las vacunas que no van a aprovechar todos en el tiempo que viene. Sorry about those.
Muchas gracias, Dr. Kampa.
So this is exactly what we're talking about. So this great quote, people often say that motivation doesn't last. Well, neither does bathing. That's why we recommend it daily. So the point is the behavior won't stick if the patient isn't able to make it their own. They are the source of the solution. Help them find it and don't fix it. So this is what this shows is it's not a one-time fix. You don't just, motivate one day and it lasts forever. It's something that we have to continuously work on until maybe we get through to that person and hopefully, or find what is the most meaningful to them to be able to connect that with the goal in hand. Next slide, please. So these are pointers of how to assist in change. So again, the biggest thing is to find what motivates people and help them move towards that change, not just based on what our beliefs are. We think, eating well is good. You can't eat bad food, right? Don't stay away from French fries or high sugar food. But you have to think, maybe in a cultural way, like what do they eat on a regular basis, and maybe tailoring that, for instance, to what can we take out one at a time, or in slow, like small percentages until we get to the goal, like things like that. So essentially, take interest and concern, ask why without being obviously judgmental, and find out what the values are for this person. Listening is such a big important thing, right? I mean, sometimes all of us need work on listening. I think really taking the time to hear out what they're saying and to get that information and to get what really is maybe bothering them or their highest concern, and doing so with empathy is very important. And this is where you really gather information, maybe perhaps discover what the issue really is. And the last piece is really, in order to empower, you want to explore, use excitement. Again, going back to concerns and what the fears are, and maybe there are fears that you can address in terms of like with the knowledge that you know, and definitely be creative. And again, it goes back to building trust and rapport. And remember that everybody is different, and this will take time. Sometimes you get a breakthrough a lot sooner, and sometimes it may take a few sessions, but it's important to follow up. And if you judge the climate, and if you feel like they're still not ready, just at least ask them if you continue this conversation in a different day, which we will talk about in the next slide. Next slide, please. Okay, so what is motivational interviewing? So let's talk about the definition. Motivational interviewing is a collaborative, goal-oriented style of communication with particular attention to the language of change. It is designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion. And again, this is all about empathy, right? And connection. Next slide, please.
I'll just preface this too, that we're not expecting this entire group to become experts in motivational interviewing. We're trying to give you the groundwork and foundation of the techniques so that you can adopt them into your conversations with these patients, because motivational interviewing is a advanced behavioral therapeutic intervention that a lot of behavioralists, social workers, psychologists use when discussing change and behaviors with patients. But we're trying to just give you the nuggets and the key pieces of how it works so that you can adapt that into your conversations with folks.
And would you start? Oh, go ahead.
Would you say motivational interviewing? It's kind of an awkward expression. Like it's not something you would stumble across in kind of everyday conversation or speech, but it's really a way of talking to somebody where you can help them find their own way to a different decision or conclusion. So it's kind of a way of having dialogue with someone where you ask them questions and then they kind of find their own way to a different outcome or to a different resolution. So I think that's how I've understood motivational interviewing. Would you kind of say something similar in lay speak?
Yeah, absolutely. It's going back to what we talked about is the overarching goal here is the bidirectional communication. Is to having that platform of not just telling someone what to do, but really finding out what the overall concerns are, and then again linking it to the goals that you have at hand for that person in terms of a healthcare in healthcare environment. So yes, this is one of the best practices as we move towards more of the bidirectional method and approach to patients versus just telling them what to do, right? Because we've again seen that hasn't been effective. So again, it's all about yes, it's absolutely by a dialogue and to be more collaborative with the patient, essentially.
Yeah, that whole notion of the bidirectionality. You think often of going to a doctor's office and the doctor just tells you what to do.
Exactly.
But sometimes that's not enough to change someone's behavior, particularly if they have questions or if they're not convinced or if they have, barriers to being able to actually, change their behavior. So when we talk about bidirectional, it goes both ways. The doctor and the patient have a conversation with each other and they listen to each other. There's not only one expert in the room at that point, there's two experts sharing their points of view so that they can achieve a better outcome together. So that's really how we're talking about having that conversation and dialogue with the people in the community so that you can hear what they have to say, you can respond, and hopefully through that conversation, each of you walks away with a different understanding, and hopefully we can really change people's their attitudes and then their behaviors.
Absolutely. Yeah, if there's anything we get out of this, it's a bidirectional, the listening piece and making sure that we take into consideration what the patient wants and needs. But yes, it is a very, we can delve deeper into motivational interviewing, but just to let you guys know, there is no wrong way. Really, we'll show you what to avoid, but there is not necessarily no wrong way of doing this, especially since you're just maybe learning about this. And the key really is to listen and to try to communicate effectively both ways, not just telling them, but also hearing them out. Okay, next slide, please. So these are the quick kind of like what to do or avoid. And again, there's no wrong or right way, but there's a better way of doing things, right? So some of the do's is honor autonomy, allow the freedom not to change. How ready are you to change? Collaborate. What do you think you'll do? Elicit motivation, which is what would you like to change about your drinking? And a lot of times you want to also connect it to what their values are in life. Maybe it might not be them, just like in the vaccine situation. Maybe it's for their children to see them grow up, or to also be an example for their children and make sure they have better habits. And what to avoid, making judgment statements like you really need to stop drinking, or push for commitment. If you don't take care of your diabetes, you could die. Or dictate, I would urge you to start exercising today. So it's really, again, about how you say it, not necessarily what the message is, because these messages, even what to avoid, are all probably true, but you want to do it in a way where it's empathetic. Next slide, please. So quickly, this is, the question is, what's an open-ended question, right? Sometimes it's also about delivery. You can use why in certain cases, especially as a follow-up, but really you want to say things like, tell me, can you describe, or what are your concerns? Those are more of the open-ended versus just asking a yes or no question, which is normally a closed-ended question. Next slide, please. Okay, so now we're going to be facilitating effective conversations about COVID-19 vaccination. So getting to more examples and into the weeds of how motivational interviewing works. Okay, so start with the presumption to normalize COVID-19 vaccination. Start with a presumption of vaccine acceptance, but keep an open mind. And this may include making a clear recommendation. So some of the examples are, there you go. I don't see that you received a COVID-19 vaccine in our records. Have you received one elsewhere? That's kind of like a starter. And you're eligible to receive a COVID-19 vaccine now. Can we help you schedule an appointment for one? I recommend that you receive a COVID-19 vaccine. Can we schedule that for you? So definitely start with a more like opt-out free approach where you're asking them if you could give an appointment versus just telling them, do you want a vaccine, etc., right? But if there is reluctance, hesitation, or concern, you want to click again, sorry. If there's reluctance, hesitation, and or concern, use motivational interviewing to facilitate a conversation about vaccine confidence. And you can do this by, again, building rapport, and avoid asking, why don't you want the vaccine, but really asking, what are your concerns about the vaccine? Tell me what the barrier is to getting a vaccine, methods like that. Next slide. So general principles for effective COVID-19 vaccine conversations. It may take multiple conversations to build trust with patients and to address their concerns. It's in line with what we were talking about earlier, right? Only because you talked to them today, definitely try to do what you can in that conversation. But the biggest thing is definitely try to follow up and continue to build that trust and build that connection with that person. Trust-building behaviors are meaningful steps towards addressing inequities with vaccination, as well as other inequities found throughout the health systems. And as we talk about what you guys want to do as CHWs, this will also help with engaging them back into the healthcare environment, and also to offer the wellness center resources. So this is going to be a big step to many things that we do with our patients. Next. It is important to understand why, the reasons and feelings underlying a person's choice to not get vaccinated are essential to increasing the likelihood of successful conversations. So while it's important to understand why, asking that directly is not normal. Remember, we don't want to always ask it directly, but yes, definitely trying to pull those reasons from them in a empathetic way is very important. Okay. So now preparing for the conversation. So I think this, when we talk about empathy, you have to put yourself in a situation. So next bullet, please. So you have to consider how you might react or feel based on what the patient might say during a conversation. How will you set these reactions, feelings aside to ensure you are listening and hearing the patient's perspective and concerns? And this goes back to bidirectional communication and also putting your own beliefs and kind of biases aside to really hear out the patient and whoever else you're speaking to, even if it's your colleagues, to be able to then communicate effectively. Expect resistance, but see it as an opportunity to explore further, and also use tools you just learned about, kind of like the different personas, and then also then is specifically asking them what their concerns are. And then review information related to the vaccine and have references and resources available. And it's always great to use like things like this PowerPoint side where more everything is cited versus saying, they said, I heard, right? Those are very general. So it's more powerful to say that this is evidence-based, you can look this up, etc. And then that can definitely promote the trust with the person you're speaking with. And last but not least is to practice with a trusted colleague, which we're hoping we have time for today, although we are running out of time. So let's definitely speed up the next slides. Okay, preparing for the conversation again, what to avoid, assuming you can convince someone solely with facts about vaccines, which we all know, especially based on delivery, may not always be possible. So we definitely need to foster that trust. Expecting someone will do what you recommend because you are an expert. Again, that's definitely thinking from your end only. So we need to be more open-minded. Judging someone for not wanting to get vaccinated, even if it means, for the better good of the community, we just need to, those approaches really never work. So we just need to define again what the concerns are for that individual. And ignoring or minimizing someone's lived experiences. So again, you want to put yourself in that person's shoes and try to feel what they would feel considering what they've gone through. Next slide, please. Okay, so overall, to summarize everything, build vaccine confidence among patients. Try to use the basics of motivational interviewing, which include, asking open-ended questions, reflect and respond, affirm strengths and validate concerns, ask, provide, verify, summarize, and describe action. And you see some of the examples here. I'm not going to talk about it. You can just read it here just so that we can move on, and we can give you some time to ask questions and perhaps practice.
Yeah, actually, Faye, let's pause just for a quick second because I think points 2, 3, and 4 are really important in structuring the conversations.
Okay.
Right? Whenever you're reflecting a response to a patient, you want to tell them that you understood what they just told you, right? And that you're actually listening, right? So that's confirming to the patient that you're hearing them. Affirmations are really important, right? And really trying to find positives within what they're telling you to affirm that what they're doing and the decisions they're making are positive for affecting their health, right? It's great that you're starting to think about the vaccine. It's great that you're worried about your child's health, right? Like those are all positive affirmations that people can start to. People like positive feedback, right? More than negative feedback, and so we want to make sure that we are affirming those strengths that they have. And then it's always critical in motivational interviewing, and especially when, and I'm sure our CHWs have experienced this, when we're engaging with people on this subject that is now very, very touchy, we should be asking permission to proceed with certain parts of the conversation. If the patient is already, we heard from Heather and from some of the other CHWs, right? They don't want to engage, they walk away, they're angry. But if we're forcing ourselves onto people, that's not going to be helpful for them to be more accepting of the conversation and eventually the vaccine. So it's really critical that when someone tells you something and you're about to offer information, that you ask them first, is it okay if I give you some additional information, or is it okay if I share with you what I know? You're telling me this, I've read this. Is it okay if I give you a summary of what this told me? Because if a person is not ready to listen reciprocally, then the conversation is not going to go that far. So these 3 steps are really, really important before you start to summarize and say, hey, I heard what you said. It sounds like you're on that fence about getting the vaccine. Here's this information that we talked about. Let me know when you're ready to get the vaccine. I'm here tomorrow. Let's talk. Right? Like you summarize and give them some follow-up actions. But these steps 2 through 3 are really, really critical when you're talking to these patients about this vaccine conversation. Okay, so let's go over some concrete examples. I think that's on the next slide.
Before we go on, I just wanted
Yeah.
to say we have a couple comments / questions in the chat. I'm gonna, because they are in Spanish, I'm gonna ask my colleague Juliana to read them out.
Yes, sorry, I was on mute. So let's start from the beginning. Juana Mena is sharing that the biggest thing that we could do is listen to the community and bring that connection. And then she shared that the biggest concern that the community members have is that if they are already vaccinated, they will not be infected with new knowledge of COVID or new variants of the COVID-19. Also, when someone in the family dies from COVID-19, they are a little more reluctant to get vaccinated.
Those are great points, and that's exactly what we're hearing from a lot of patients. Those exact questions, sentiments, comments. Thank you for sharing this one.
We also have some comments in English. Do you want me to read those or? You're on mute, Heather.
Oh, yeah, you're on mute, Heather.
Yes, I am. Yeah, I was just those last two comments from Juana. I wasn't sure that I was getting the nuance of it quite right, but thank you. And certainly that comment, I think it echoes a little bit of some of the chat we heard last time, that sometimes if COVID has had such a deep impact, people are traumatized. They don't want to talk about it. They don't want to think about it. So even though the vaccine could be helpful for the future, they're just resistant because the whole experience has been so negative around COVID. So anyway, just some comments about where people are at and the different things we have to contend with in those community conversations.
Yeah, no, to just echo that, there's so many patients who were tangibly affected by COVID. Either they were infected or family members, or they knew somebody who passed away, and they're nervous about the vaccine because of the just association with the infection. And we know that, people who have been infected and recovered with severe illness, they have, and if they get a second infection, they're at higher risk for more complications. And so those conversations are difficult because some people are saying, I had COVID, I survived it, I'm going to live my life, right? Well, let's live your life vaccinated, right? That's what we want to say. But we also have to meet them, as Faye mentioned, kind of at their point and at their level, and really start to engage with them to figure out what is the real underlying issue behind a lot of those sentiments. And so that's what these conversations are meant to do. All right.
Thank you so much.
Okay. So one thing, if I hope we do have a few minutes to practice, so I'll go through this fairly quickly. But one part that's really helpful in having difficult conversations is practicing. And so even just practicing by saying the question with your mouth and just verbalizing and getting the muscle memory and the brain memory ready is really helpful before you even start to practice with a partner. So let's go over some examples. And if you want, if everybody's on mute, go ahead and just say the question so that your mouth and your brain can get used to saying these words and preparing this phrase for when you're talking to people. So asking open-ended questions, right? And building rapport by asking them permission. So here's a recommended quote. Is it okay if we talk a little bit more about the vaccine and your thoughts and feelings about getting vaccinated? So go ahead and practice that if you want. Is it okay if we talk a little more? Right? Is it okay? Like, we don't say that in regular conversations, right? Even with our partners and our families, right? We don't say, is it okay if I talk to you about why you're angry? Right? That's not something we do. So practice it. Is it okay? Eliciting the perspectives and feelings and concerns about the vaccine. I'm curious to hear how you feel about getting vaccinated. I'm curious. I want to hear more, right? Say that. Practice saying that. What are some of the pros and cons for you about getting vaccinated? What is positive? What is negative? Tell me what that is for you. reflection questions. If a patient tells you, I don't think I need the vaccine at this time. Also, my brother got the vaccine and he couldn't get out of bed for 2 days. A response that uses motivational interviewing techniques and reflections would say, it sounds like you have some concerns about the side effects. Those are valid, and many people have those similar concerns. And we're saying, we heard you about your brother. We know that this is a common concern in the community. And then now we're asking, would it be okay if I share with you some information that I've learned? And again, so we're asking that permission. I heard you say you don't think you need the vaccine as well. What situations will make you feel like you need the vaccine? Right? So we're not only saying that we heard you that you don't plan on getting it, but tell us more. What is going to help you, or what situation might change where you might want to get the vaccine? Because then we can leverage that information in the rest of our conversation. So again, this is that other key piece, affirming strengths and validating concerns. Patient might tell us, I'm in good health and I didn't get sick last year, and now no one around me has been sick. I think I would get the vaccine if more people are getting sick. I don't think the side effects are worth it for me right now. So how do we affirm the strengths, right? We can say, I heard you say that you don't think you need to get vaccinated at this time. What situations will make you feel like you feel you need to get the vaccine? So that's, again, they're saying we're validating their concern. And then we're affirming their strength. It sounds like your health is very important to you, right? This person said they're in good health, they didn't get sick, no one around them is sick. And I understand you have the concerns about the side effects. Tell me more, right? I want to hear more. Which side effect is it that's causing you to have some resistance? Okay. So the safety and efficacy should always be explored, right? We shouldn't just say, again, as a blanket statement, well, the vaccines are safe, right? The data shows that they're safe. Let's actually, familiarize ourselves with some of these side effects and the safety, so that we can have more meaningful conversations, right? And so this is information that we could post for folks to read, so that you can understand more, right? Like, how many patients are getting sore arms, right? So, 70% of people. So, you're very, very likely to have a sore arm, right? How many people are having anaphylactic reactions? Oh, less than 1%. So if it's one person out of 100 who has allergies, right, there you might have some side effects, right? So we have to have some conversation pieces in our toolkit and in our tool belt, right, when we're talking to patients, so that we can actually continue to engage them, right? Because when a patient sees that you're hesitant, or you're kind of racking your mind to try to get to that next part of the conversation, they're going to know that you don't know what you're talking about, right? So it's keeping it fluid, and actually those reflections and affirmations, and actually having the patient tell us more and more information. It gives you some time so that you can actually find in your brain and say, okay, they're talking about side effects. Okay, let me ask them more about side effects so that I can start to get my talking points in mind, so that as soon as they tell me that it's about feeling sick, I know, 30% of people feel sick, but you can take Tylenol, you can rest, you're going to get better in 3 days. I'm ready to have that conversation piece with them once they express what that kind of core issue is. And again, that validation is really, really important to patients. And we're not agreeing with them, right? We're not saying not being vaccinated and their reasons for it is important, but we're validating those concerns, and we're trying to find those strengths that are kind of hidden in there about the importance of their health, the importance of their decision making, the importance of their families, right? So that we can leverage that conversation and pivot it toward why the vaccine might be something that can be additional importance for them as well, and that shared value. Okay.
We have a comment in the chat, Dr. Kampa. Tamara is mentioning, from her experience, young people who have not been vaccinated affirm that they do not need the vaccine, that the virus for them or those they know has been like the flu, so they don't need vaccination. The only people who need to get vaccinated are those at risk with chronic diseases. How would you respond to that comment, Dr. Kampa? Let's do a little role play. I don't need the vaccine. I'm fine.
Yeah. So tell me more. What have you heard about the vaccine, and why young people don't need to get it?
Well, I as a young person who've already had COVID, it wasn't bad for me, so I think I'm fine. There's no reason for me to get the vaccine. My symptoms were minimal, and I'm fine. I have protection now.
Well, I'm really glad to hear that you made a quick recovery from COVID, and glad to hear that you're feeling well now. I'm also concerned that you got COVID. I'm wondering, what more about your experience with COVID can you tell me? Was anybody else in your family affected? Anybody in your community that you know also had COVID?
Yeah, there were some other family members who had COVID too, but in pretty much everyone, it wasn't bad. It was just like the flu.
Yeah. Well, I'm really glad to hear that again, and it sounds like your family and your community was lucky. A lot of families were not. So I'm wondering, has anybody in your family, who got COVID, have they considered vaccination?
Yeah, I think one of my aunts decided to get vaccinated, but I don't know. Not a lot.
Okay. So it sounds like there's been some mixed decision making in your family, but thankfully everybody has been doing really, really well. Well, is it okay if I share with you some information about the vaccine and why we're recommending that young folks who are healthy and who had been infected with COVID still get vaccinated?
Sure, I'm happy to hear it.
Great, thanks. I appreciate that. So the reason why we're really trying to get people who were fortunate to be healthy enough to recover from COVID to get the vaccine is that because we know that the way the vaccine spreads in the community, oftentimes it was happening with young folks who had either mild symptoms or no symptoms at all. And the reason why it's super important for us to think about vaccinating this group is that they have touches in a lot of places in our community, and it might even have touches with vulnerable folks in our community. So our elders, young children, people who are ineligible to get the vaccine, and we know that those groups sometimes have worse outcomes with COVID. And so, while it sounds like your family was fortunate to do really well, I'm wondering, is there any activities that you do in the community where you might be interacting with some of these groups that might be at higher risk for COVID?
Yeah, but because I already had COVID, I wouldn't be able to get it and transmit it, right? I mean, even if I'm out in the community with other people, but I've already had COVID, so I can't carry it to anyone else.
So, is it okay if I share some more information with you about that
Sure,
as well?
of course.
Great, thanks. So it is possible, if you've had the infection, you do have some natural immunity. That immunity doesn't last as long as the immunity that we've seen with the vaccinations, nor does it give you as much of a robust protection as the vaccine does. And so it is possible, in the future that you may become infected again. And again, this new variants that we're seeing may cause worsening infection. And we do know that it spreads faster and easier than the prior virus that we saw in the community earlier in the year. So if it's okay with you, I'm going to give you some information for you to look over. I have a contact number for you to call if you decide to get the vaccine. And as always, I'm available to talk with you if you have other questions or other of your family members want to get vaccinated. I'm happy to chat with them and get them scheduled over for us to get the vaccine.
Okay, thanks. Yeah, I didn't realize that I could get it again, so I'd love to know more about that. All right, thank you, Dr. Kampa. We have another comment. Alejandra, would you like to ask your question of Dr. Kampa and do a little role play with him?
Okay. So the question it was a comment from the community, and their comment was, I don't want to get vaccinated because I want to wait for the long-term effects.
So they're waiting to look at the long-term information about side effects and safety.
Yeah, so they're like, what's going to happen to us within a year or 2 years? We're going to develop cancer from the vaccine, or our organs suddenly will start to fail, certain things like that.
Yeah. No, that's a valid concern. So I'm wondering, where have you heard some of this information being shared?
Well, we've seen long-term side effects 5 years, 10 years down the line on certain medications or certain procedures, where, oh, if you got this procedure done, please call this number because people are getting cancer, or, their heart is failing. So are we going to hear that down the road from this vaccine?
Mm-hmm. Interesting. I'm wondering, have you experienced any prior side effects or kind of complications from medical treatment before?
No, not personally, no.
Okay. Yeah, no, that's a very valid concern, and I hear that you're worried about complications and side effects. You're right. It's common to see this in different treatments that we have in medicine, and you are correct. The vaccines for COVID do have some short-term side effects. Is it okay if I share with you some of the long-term information that we've seen so far?
Yes, of course.
Yeah. So far, we haven't seen any long-term side effects with the vaccine in terms of cancers, chronic illnesses, or diseases. What we have seen, though, is actually long-term sustained immunity and protection from getting COVID, and then again, even worse, being hospitalized or dying from the infection. And so far, that has been really one of the positive things that we've seen from the vaccine.
Okay, what can you tell me about the side effects that some of the youth is getting in terms of is it myocardia, the heart?
Yeah, so that is a side effect that we've seen where there is some inflammation of the heart, and the cases that have come around have been very, very few. And again, the body that oversees how we give the vaccines looks at this information daily. And as we've seen from earlier in the pandemic, when they temporarily paused the Johnson vaccine because of a question around clots, they would do the same thing if they saw an increased prevalence of side effects that would be dangerous or concerning for the community. So while there have been a few cases that might be associated with the vaccine, in general, for almost every person in the community, the vaccines are safe.
Okay, and so with the myocardia, is that a long-term effect that's going to last them, or is that something treatable?
So again, oftentimes these side effects are treatable as long as we catch them early. And again, so far from my understanding of the cases that they've seen, all the patients who have been diagnosed with this issue have not had any long-term complications thus far.
Okay, perfect. That was very helpful.
Yeah, no, of course.
Yeah, that's exactly what we hear out there. So that was very, very helpful. Thank you.
Yeah. No, again, so right, like what I'm doing, right, is trying to reflect the question. I'm trying to find affirmations and strengths. I'm trying to wiggle my way into this person's life and try to find what their values are. And you're right, like these are conversations that we don't normally have in the community, especially with our peers, right? We're talking about things happening in the community. We're talking about sports. We're talking about vacations. We're talking about family members. We're talking about chisme, right? Like there's so much that are going on in conversations that happen naturally. But the way that we integrate these motivational interviewing techniques into conversations, it really you do have to kind of wiggle and kind of work your way into the meat of that conversation to find what those patients like true questions, true values are. And it does take a little bit of practice. It is a little bit, you can get a little bit nervous doing it. But at the end of the day, people actually feel really, really positive emotions when they know that they're heard, right? When they know that like there's a doctor, there's a nurse, there's a community worker who has a badge from the county, LEC, USC, right? Like this is somebody who like is worried about me, and that is really powerful for patients to hear that and feel that, and so that's what we're hoping really to kind of leverage with that group of patients who are just on that fence and maybe just need a little bit more support to make that decision around the vaccine.
Perfect. So you think it's important for our community health workers to always be on top of the information that is coming out as it's coming out? Like, for example, the CDC, the WHO organization, their 5-minute science videos on COVID.
Those are really helpful. And even locally, the LA County Department of Public Health website, I always reference covid19.lacounty.org. There's so many resources and videos and hot sheets and little, printable signs for patients and handouts for them that really simplify the current information around the vaccine, around COVID, and what they should be doing. And so, and then getting those snippets from the CDC, that's helpful for kind of these new questions and new hesitancies that people bring up. I have to keep myself up to date because there's so many changes on a day-to-day basis. But I think as long as you have a general sense and you're confident about what you're saying, patients will hear that in your voice and they'll feel that in the conversation that you're having with them.
Okay. Thank you.
Yeah. So let's move forward real quick. Okay. So these are again validating and affirming statements, right? I value safety as well. Tell me more about what you've learned. I heard the vaccine can change your DNA, right? What else have you heard regarding that, right? So that's a question that I use actually in one of the conversations. What have you heard about the side effects, right? That's what I said to right now in the conversation, right? And then that final key piece is to ask for that permission. What other information can I provide you with that might be helpful? What would be some benefits to you for receiving the vaccine? Based on what we discussed today, how have your feelings changed about the vaccine? So let me verify, what we just discussed and how I think we can move forward together. So just some tips on providing information. So again, finding those shared common values and connecting the factual information for the reason for why we're getting vaccinated. So I want you to remain healthy. Here's what I know. I'm concerned about my family. This is what took me, to get my family to get vaccinated. Keeping the information clear and avoiding really big scientific words, right? I always try to do that with anything that I do with my patient conversations. I'm not talking about, the proteins and things like that. I know the information, and if a patient wants to hear that, I could get to that level. But most of the time, I'm keeping it really, really basic for them to understand general concepts. And then offer recommendation, right? Like, I believe in the efficacy and safety, right? Like this, if it was me, right, I would do it, right? Because oftentimes patients will tell us, like, what would you do? What have you done? If you were in my situation, what would you do? And so really giving a firm standing of what your decision is important sometimes for patients to hear. And then giving them that respect, putting it back on them and saying, this is your decision. I'm giving you this information. I want to help you make a decision that's best for you. Let's, tell me what you want to do moving forward. And then the final piece, summarizing, right? So all these conversations happening, right? And that's why motivational interviewing and having these conversations is tricky, because you're constantly trying to catch from the conversation important pieces and synthesize it at the end, right? And reflect and respond, right? It's a skill that takes some practice, right? And so at the end, though, you want to summarize and say, thank you for sharing all this information. I hope this conversation was helpful. What can we do now? Like, what's our next step? Can we check in? Do you want to get the vaccine? Do you need some more information? Here's the packet that I have, right? We need to summarize and close out the conversation with an action step. Right? I'm glad you feel ready to get vaccinated. Thanks for having this conversation. let's schedule you. Here's some dates and times, right? Let's be patient-centered about it, right? Like, let's not just force them, right? Like, oh, you have work today? Sure, you can't come today. Let's schedule you tomorrow, right? Let's be patient-centered around these action items. Okay, so if they say yes, let's vaccinate them if we can that day, and offer them praise and positive reinforcement. If they're undecided, let's try to schedule a next touch point. And if they refuse, be grateful, right? Show empathy. I understand. And then please let me know when you're ready to re-engage, right? Here is my contact number. I'm open. And again, patients who there's not going to be everybody, but there are going to be some patients who felt that connection with you and are going to come back and say, hey, you know what? I saw you the other day. We talked. Do you remember me? I think I'm ready to get the vaccine. Let's do it. And I have seen that. I have seen that happen in real life. Okay. So these are just some resources that, again, you can, we'll share the slide deck, and you can go back and click on these links if you want to read some more, and find some of these other hot sheets that give you some tips. But I'm wondering then, Heather, in the next few minutes, do we take some time to answer any questions or comments, or can some of our wonderful community workers do some practice?
Yeah, I think both, because we have about 15 minutes, so we're going to do both. Only because I have one outstanding question in the chat, and I think it is important. It just goes back again that this reinforcement and this kind of, we've got to keep having the same conversations again and again, because some of this is complicated information. So we have a question from Tamar that is saying like, hey, help me understand the science a little better. If I have COVID, my body develops antibodies against the virus. If I get vaccinated, that also gives me antibodies against the virus. Like, what's the difference? Why is one better than the other? Like, just how does this work? What do we know? So basically saying like, if I've developed the natural immunity through having had COVID, what's the better benefit of doing the vaccination instead?
That's a great question.
It's a complicated one too.
Yeah. So again, when you get the infection, you are going to have some natural immunity. But again, on top of your body developing immunity, it's also working to fight off an active infection, right? And especially if you have a severe infection, we're not sure exactly how robust of an immune response you're going to have, because your body is busy working on all the damage that the virus is doing to your body. When your body is in a good state of health, and you receive the vaccine, it really focuses the body's immune response only to give you antibodies for the virus, right? And it's not working to fight off pneumonia or fight off, kidney failure or fight off, what other complications that the virus is causing. So it allows you to build more robust immune responses that last longer periods of time. And again, so far from what we know, coronaviruses are different from other viruses that we vaccinate against from. And so we don't anticipate that there'll be such a quick turnaround for booster shots like we see with flu and with other vaccines. And so we do anticipate, again, if we get to a herd immunity level, that the community would not need to get, such quick boosters, yearly. So that's why we're trying to get everybody vaccinated as quickly as possible, so that the community's immunity is at a level that prevents the further spread. But that's I don't know. I hope I answered that question. I know it's kind of went to two different levels.
No, I don't know. That to me, that's kind of helpful, because that's the whole science of vaccines from the beginning, right? It's like you give someone a very minor dose of the disease, of the condition, and then their body just focuses building up antibodies and immune response without actually getting super sick. So you might have a little bit of a symptom, a little bit of a flu symptom or a cold symptom, but you're not having full blown COVID. So your body's able to kind of respond to that and just focus on a response to a very minor version of the disease. And so you actually end up with a stronger antibody and immune response. I think a lot of us, that's a little counterintuitive, because you think like, oh, if I had full COVID, then my system should be 100% ready to go and resist it for the next time. But maybe it's not that way, because your body was actively like managing the disease and fighting all the symptoms. And so it wasn't able to just focus on building that immune response up. So I don't know, that makes sense to me, but you don't need to convince me because I've already got the vaccine. But anyway, yes, for now, would we like to have some testing, or not testing, but some modeling with members of this team? Do you guys want to practice any of your skills, or would you like to do a role play with Dr. Kampa? Where would you like to go with our final 10 minutes, Dr. Kampa? Or do we leave it to the group?
Yeah, let's leave it to the group. If any two volunteers want to have a conversation with each other, I think that'd be helpful to see. Maybe, what about Kevin and Magali?
Oh, Kevin and Magali. Yeah, all right. Maybe Kevin, you can be the med student you've met who doesn't want to get vaccinated.
Yes,
Magali can see if she can, get some inroads there. And I do encourage, we only have 10 more minutes left as this collective, but I know each of you is in a team of your CHW partners. And I encourage you guys to, go pair up after this or coordinate with your supervisor to have another follow-on training where you can use some of these tools, some of these ideas that have been shared by Dr. Kampa and Faye, just to practice your dialoguing and just refine and get better at what you do already so well. So Kevin and Magali, are you ready to go? We're putting you on the spot.
Is Magali on? Sorry, I don't know if she is.
Oh, actually, you know what? I'm so sorry. She had
Heather, she's
this morning.
Yeah, she's at food distribution, Heather.
I forgot, Elizabeth. Thanks for saying that. Okay. Well, how about Elizabeth and Kevin? Would you guys be ready to go? I know we're putting you on the spot, and I apologize.
I was like, I'm being put on the spot right now.
You're amazing, Elizabeth. You're amazing, Kevin. I know you.
This is scary.
We're here to provide feedback and learning, so it's a learning environment, not a critical environment. So
exactly. Yeah, I think it might be a little intimidating for people to step forward. There are about 40 people on the call, so 44. So
all right, we could do another role play with Kevin if you want. I'm happy to be. If you want, we could switch roles, and you can be the community worker educating the peer, because I want to hear from you, right? You've had some experience in talking with your peers, and I'll be that student who doesn't want to get vaccinated. Is that okay?
So actually, Dr. Kampa, I noticed we've got a few more questions in the chat.
Okay.
So maybe we'll postpone the role play exercise and ask people to do that on their own, and maybe we'll generate more questions that we can bring forward in another setting. But from Juana Mena, we have the question about what's the difference between COVID-19 and the Delta variant? There's a lot of confusion in the community about what that means.
That's a great question. So the Delta variant is a version of the COVID vaccine. Sorry, not the COVID, so of the COVID virus. And so the original COVID virus, because it started infecting so many people, when the virus infects a large group of people, it has a higher chance that it might mutate. And so that means the virus has a slight change. And this happens naturally in the world, right? This is evolution happening in front of us. And what happens is that viruses that work better are going to start to infect people quicker and easier. And viruses that mutate to function less better, they start to kind of die off. So because the Delta variant was the fourth mutation that they found, this variant, unfortunately, was just way better and quicker and stronger at infecting people with COVID, that it took over all of the other types of variants that had already been mutated from the original coronavirus. And so now it's the predominant virus mutant that's infecting people in the community. And unfortunately, again, like I said, it mutated itself to be more infectious and more more virulent, more causing more severe illness, which is why it's been more worrisome. But thankfully, the vaccine still protects against this variant, which is why we're trying to tell people, there's this new type of the virus out there. It might infect you more than the one that we saw last year. Please get vaccinated, because the vaccine is going to protect you from being worse off than the infections that we saw last year.
It's kind of like the flu, right? Because the flu is also a virus. We have flu season every year, but actually the flu virus that infects us any given year is different than the one the year before, because it mutates over time. And so some years flu is really, really bad. Many more people get sick and the symptoms are a lot worse. And then some years they say like the flu season is kind of mild. So the coronavirus is like that. It's a virus too, just like flu. It's the same virus, but now it has different strains, different versions out there in the community. Some are stronger, they transmit more easily, and they have more severe symptoms. And that's what we're seeing with Delta. So right now there could be 10, 20 different versions of COVID out there, but the one that's really hurting people right now is the Delta. Is that right, Dr. Campa?
Yes.
Yeah, so that's how I think about it, that it's, these viruses, they're very flexible. They keep changing on us. But what happens is when one gets super strong, that's the one that starts infecting the most people. And that's what we're seeing with Delta right now. So the Delta one is the one we're most scared of because it transmits so quickly and people have more severe symptoms. And it seems like, from what I'm reading anyway, more severe symptoms for younger people. We're seeing people in that, 25 to 50 age range that are having hospitalizations, severe effects. And that wasn't as true with the original coronavirus, but now the mutations are really, taking hold and becoming more serious.
Exactly.
So, any other questions? And Juana, thank you for your comment about doing drills so people can practice. I absolutely agree. And we will encourage, our CHW team to go back and practice some of this together. I think that's a great use of time to just work out all of the ways that you respond to these very complex questions in the community, find the right words and language that works for you and that you think will be, culturally appropriate to the people you're talking to, that will meet them where they're at. So I definitely will encourage that exercise. Any final questions, things that you've heard that you need a little more expertise on? How do we respond to this question? How do I answer one?
¿Puedo hacer un comentario?
Sí, hi. Hola, Juana.
Hola, hi, good morning, everyone. Quiero dar las gracias por este entrenamiento. Es muy bueno porque ahorita en estos momentos se necesita que tengamos las más herramientas posibles, porque como lo comenté, el ambiente está muy hostil de parte de la comunidad y principalmente que tienen ese miedo, esa desconfianza de venir hacia el doctor, hacia el hospital, por la inseguridad que tienen y la falta de información, aunque se está haciendo mucho trabajo por parte de todos los equipos, pero agradezco mucho esta oportunidad de haber participado en este entrenamiento.
Muchas gracias, Juana. Sí, gracias por su trabajo en la comunidad. Ahora es la parte muy importante, es entrando y juntando con la comunidad y apoyando las personas en su ambiente, ¿verdad?
Sí, porque han pasado casos. Yo tengo una vecina que creo el papá acaba de fallecer de COVID, desafortunadamente, o sea, algún cuadro clínico ha de haber tenido que le afectó más y ahora la señora ya está muy renuentes a vacunarse porque dice que para qué su vacunan si su papá tenía la primera vacuna y de todos modos se murió. Entonces, es algo fuerte, pero juntos y con este tipo de entrenamientos vamos a llegar poco a poco a más gentes.
Claro, espero que sí. All right. Well, thank you everybody for all the comments. Thank you for engaging with me in some role playing. And please, look over these slides, practice verbalizing those questions. Even if it's in front of a mirror, it's really helpful to just get comfortable with the mechanics of talking in this way. And I really hope that, Faye and myself can continue to be a resource for you all. And we're happy to see, a few of the workers come into the primary care sites, and, we'll see how that project goes. But I definitely want to hear more about those out in the community and what you're hearing. It'll be helpful for us to understand, what's really happening on the ground, and strategize on how to continue providing support to you all to engage those folks.
Yes, absolutely. Thank you everyone for coming. Thank you for bringing your questions. Thank you, of course, so much to Dr. Kampa and Faye for all your time. I know we originally scheduled this for 1 hour. We have now hit essentially 3 hours across 2 weeks. So it just goes to show how much interest there is in this. And I want to, say thank you so much for the opportunity to invite our CHWs, our care coordinators. We mentioned this yesterday at the partner meeting for the Wellness Center, and our agency partners were like, can we come too? So I know, guys, that for two things, if we could tap back into some more training for our core team, as well as maybe a town hall for residents that really would like to have this opportunity to speak with you directly. I think there's a lot of interest and need, and I'm so excited that you are our partners in this work. There's one additional question from Tamar, and it was about someone leaving something in someone's arm after a vaccination, like a metal clip. I know I've seen online people think that the needle is left in your arm, or of course there's been the chips left in the arm. So just in our final 30 seconds, can you respond to that, Dr. Kampa, about anything being left in your body after the vaccine?
Yeah, we talked about this last week, that there was some questions that had come about, staining the vaccine, or even the needles that we use that have retractable syringe that pulls the needle in. All of that, again, is false. There's nothing other than the liquid solution that has the vaccine components that's left in your arm. It's I don't know. This question has come up a couple times, and I'm not really always sure what a patient wants to hear. But it doesn't make sense for the government to invest money in whatever nanotechnology that might be put into an arm, right, through a vaccine. I think the confusion with the metal tip, I think, can be demonstrated by showing the patient the needle after their vaccine. If they're really concerned, saying, "Here's the needle. Here is it now inside the syringe," and just kind of sharing that information. But yeah, there's no chips, there's no dyes, there's no stains that are going into the vaccine. It's all just the material to boost your immune system. And so I hope that clarifies the question.
Yeah, I know that's a really hard one, because it just seems like it's such a made up fact. People that I think we have to understand too. A lot of people that are pushing this false information on Facebook and on these other channels, they make money. They make money by doing that. They are incentivized and motivated to lie, and to lie big, because then that captures so many people's attention. So I know when the community is reading things that seem like they are, insightful and smart, and someone's trying to turn you on to the hidden truth of things, but some of these they're just absolutely made up. There's no backing to any of it. And I think when we look at the needles themselves, the needle is so skinny. Like, there's really nothing that could be in there. No metal clip, no metal needle, no chip, no nothing like that could get into your body. So I don't want to minimize that people are worried about these things. I'm confident that whatever they read made it seem really scary and really real. But unfortunately, there's just a lot of bad information out there that is not remotely true. So we have to do our best to try to understand where they read that, why they trust it, and maybe say, but maybe it's not the truth. Maybe there's actually, like the other sources that could give better information. So I thank you all for bringing forward those questions and those comments, because I know it's a very difficult time, and it's a time when a lot of people they don't have trust. They don't have trust in each other. They don't trust in the system. They don't have trust in the government. They don't have trust in even their doctors in some cases. And it's really difficult because that's a very hard thing to contend with. So, just appreciate everyone on this call for all the fantastic work to go out there and try to be that light in the darkness for people and show and shine some truth on what's really going on, so that we can help protect people from what we know is true, which is COVID is very serious. The Delta variant is very serious. Many people will get sick and many people will die because of this disease. That we definitely know. So everything we can do to prevent that is what we're here to do together. All right. I think with that, we are past time yet again. But thank you, Dr. Kampa. Thank you, Faye. Thank you, everyone.
Thank you guys. We appreciate your time.
Thank you, everyone.
Bye.
Talk again.
Thank you.
Thank you, everyone.
Thank you.